press statement is concerning emerging issues affecting county governments. Members of the press and citizens of Kenya, today we commence our address on a somber note as we pay tribute to the young man who lost his life yesterday after he succumbed to gunshot wounds following the protests witnessed across various counties. We call upon the National Police Service to exercise sobriety even as they undertake their duties. On behalf of the Council of Governors and the 47 county governments, we send our most sincere condolences to the family and friends of Rex Anyeki. On issues affecting county governments. The first one is concerning the resourcing of county governments for the financial year 2024-2025. We have cited a letter sent to the National Assembly on rationalization of the budget for financial year 2024-2025. We note with concern that the National Treasury intends to reduce the county equitable share by 5 billion from the 400.12 billion allocated in the Division of Revenue, DORA, after a mediated process. This unilateral decision does not only undermine the spirit of devolution, but also jeopardizes the essential services to be delivered to millions of Kenyans. It is important that the National Treasury is guided by the provisions of Section 5(1) of the Division of Revenue Act 2024, which stipulates that whenever there is a shortfall in the revenue raised nationally, the shortfall shall be borne by the national government and not by counties. We therefore wish to state unequivocally that the Council rejects this proposal in totality and demand that the National Treasury retains the county equitable share as enumerated in the Division of Revenue Act 2024 after the mediated process. Number 2, on the disbursement of pending allocation to counties. The Council calls for immediate release of equitable share of revenue owed to county governments for the months of May and June 2024, amounting to 63.6 billion. This is to ensure uninterrupted service delivery at the county level. As it is, many counties are struggling to pay salaries because we only received the allocation for April this week, and we are now asking that the allocation for May and for June is disbursed so that we can be able to meet the obligations of providing service delivery, especially in health, and also paying the healthcare workers and the county civil servants who work in the various counties. Number 3, on unbundling of functions and transfer of attendant resources. The unbundling exercise commenced on March 2023, culminating in the delineation of functions and subsequent gazettement vid a legal notice number 16170 of 27th November 2023. The same was revoked on 8th December 2023 to allow for further consultation with all stakeholders, a process that began and was completed in March 2024. It has now been 3 months since the completion of the exercise, and the transferred functions have not been gazetted. The delay in this gazettement continues to accelerate the clawback in devolution. The Council notes that this is in bad faith, and we call upon the national government to expedite the process. 4, on the clawback on devolution. Fellow Kenyans, we have continuously witnessed outright clawback on devolution, which has affected all the 14 devolved sectors. For instance, the Water Service Regulatory Board, WASREB, has issued a notice for public consultation meeting regarding the licensing of Athi Water Works Development Agency as a water service provider for the Northern Collector Tunnel. This infringes on the Nairobi County's constitutional mandate to provide water and sanitation services. In this regard, we call upon WASREB and the Ministry of Water to immediately suspend the public participation process until all constitutional and statutory concerns are addressed. Number 5, on the universal health care. We have just also concluded a consultative meeting with the Cabinet Secretary, Ministry of Health, to discuss the status of implementation of the Universal Health Coverage, UHC, and in this regard, we have agreed as follows: that the Ministry of Health will ensure that they transfer funds allocated to CHPs in the special purpose account opened by county governments commencing the financial year 2024-2025. Number 2, that the Ministry of Health shall support county governments in the rollout of comprehensive integrated health information system for facilitation of health service delivery. This will be done through the provision of requisite infrastructure for electricity and internet connectivity. Number 3, that the Ministry of Health shall cover all the costs pertaining to the rollout and maintenance of the integrated health information system. Number 4, that the Ministry of Health shall plug into the existing systems in counties in the execution of the health information system where that system exists in the counties. Number 5, that the Ministry of Health shall ensure that the 8 billion shillings owed to county facilities by the defunct National Health Insurance Fund will be paid even as we roll into the new SHIF fund. Number 6, that the Ministry of Health in collaboration with county governments shall conduct a public campaign on the rollout of registration of citizens to the Social Health Authority. And number 7, that the county governments and the Ministry of Health shall have continuous engagement to ensure effective implementation of UHC. Signed, H.E. Anne Waiguru, Chairperson, Council of Governors. Thank you very much. On behalf of my colleagues.
The issue of the transition from NHIF to SHA definitely is welcome. But the counties which operate public facilities at disadvantage in terms of payment, or the monies that are owed to those public facilities by NHIF, most of the payments went to the private sector, and most of the facilities in the public sector have not been paid. We are owed up to 8 billion by NHIF. So as we transition, we do not want to see a situation where the 8 billion becomes a pending bill for the public facilities. We urge the facilities that have not been paid for their debts to be settled by NHIF, and of course they need for them to be remunerated or given monies by the national government for them to do that. That is our ask. That is the only way we will transition to SHIF or SHA with a smooth transition, having no debt, with county facilities not struggling. The monies that we owed, that is over 2 months. For every county, 2 months disbursement is equivalent to maybe 2 or 3 months salaries. And given the fact that recently we were on the spot from the ministry as having not paid debt for CAMSA, it will not be possible to settle those debts for CAMSA unless we get our full disbursement, because we have to make a hard choice between paying debt for CAMSA and paying salaries for the workers who are working in those hospitals. So it is critical for us to get the full disbursement of up to June for us to be able to pay monies that are owed to CAMSA and other suppliers.